So this is the reason why people that have diabetes usually develop leg ulcer. So I don't know if you have asked yourself that question. Why is it that people that have diabetes usually develop leg ulcer? Most of them used to have leg ulcer. So I'm here to give you a short health talk on leg ulcer and diabetes so you understand it. Okay, so my name is Stella and I'm a health content creator. Please don't forget to click on the like button and also follow, share to go viral. Even if you're not interested or maybe this video is not for you, it's very important to listen because no knowledge is waste. You can equally share to go. Before I proceed, let me in a simple time explain to you what diabetes and leg ulcer is. Diabetes is a chronic metabolic disorder or condition that is characterized by high glucose level in the blood due to or because of inability of the body to produce enough insulin or not using the insulin produced effectively. That is diabetes. Your body might not be able to produce enough insulin that it requires, or there is insulin in your body but your body cannot be able to use it. This glucose will now begin to accumulate in your blood, leading to other health conditions. That is diabetes. So if someone is having diabetes, try to understand, is it that the person's body doesn't produce insulin, or does it mean that the body can produce but it cannot be able to make use of it? When somebody tells you that he or she is suffering from diabetes. So now, what is leg ulcer? Leg ulcer is an open wound or sore that develops on the leg or foot, and this is due to poor circulation of blood, nerve damage, or diabetes mellitus. So let's talk about the causes. We have a lot of things that can cause leg ulcer. As I said earlier, poor circulation of blood. When the blood is not circulating the way it's supposed to, it can lead to leg ulcer, and also nerve damage. Yes, when the nerve is damaged, it can lead to that. So high glucose level in the blood, that is when you're having high sugar in your blood, it can lead to that. But when someone have cuts or injury on the leg, yes, especially one that have diabetes, it can lead to that. If it's not properly managed or taken care of, it can lead to leg ulcer. And another thing again that can cause leg ulcer is wearing tight shoes or ill-fitted shoes can equally cause that. You know, when you wear something that is tight, it will lead to poor circulation. So it can equally lead to that. And again, not keeping your leg or your foot clean, poor hygiene to the leg or foot can lead to leg ulcer. Yes, or walking on barefoot, that can equally lead to that. For the signs and symptoms are when you see something like redness, swelling, pus coming out from the wound, or maybe the wound is smelling odor. You notice that there's odor coming out from the wound. That is a sign. And prolonged wound healing, like wound that supposed to have healed for a long time is taking time to heal. That is, it's taking longer time. It's not elongated. It's also a sign. Infection, it can also lead to infection. You notice that pus is coming out. All these things are sign. Sometimes again, pain or no pain due to nerve damage. You may feel pain, I may not feel pain. So that means the nerve within that area has been damaged. So let's talk about the complications. The complications are severe infection, because if the wound is not properly managed, it can lead to severe infection. The person will develop infection, serious infection, and also nerve damage or tissue damage. Yes, and equally amputation. It will lead to amputation. They will amputate the leg. So that is another thing. You have to be careful on how you manage your leg ulcer. What are the preventive measures? Things you need to avoid is avoid wearing tight shoes or ill-fitted shoes, as I said earlier. Always wash your leg or your foot. Wash your leg very well. Make sure your leg is clean. So prevent or avoid having infection. And also maintain a stable glucose level in your blood. Equally, you need to go for checkup. Always go to the hospital to check yourself, see a doctor, and monitor your leg. Yes, inspect your leg every day by day to know if there is any injury or cut or wound. If there is any, your healthcare personnel will know what to do. And again, whatever prescribed medication given to you, don't miss anyone. Follow the instruction. Avoid the things you're asked to avoid. Do the ones you need to do as well, and help yourself. I personally observe that most times, after instructing someone that have diabetes, look at the kind of food you need to eat and the ones you need to avoid. They used to see it as a punishment, that how can I be eating only this? No, it's not possible. Sometimes some of them used to, out of stubbornness and all that, they'll still go and eat all those things. My dear, I just want to, I know that it's not easy, but it's for your own good, to help you recover fast, okay? So if you know whatever you are asked to avoid and things you are asked to eat, try and do all those things to help you recover fast. It's for your own good. So guys, if you find this video very interesting and educating, do well to share to go viral. Thank you for watching. See you guys next time.